You're in a doctor's office waiting on results from a test taken last week, and your doctor comes in and says you have cancer. You need a particular treatment to live, and later you find out that your health insurance company denies the claim to cover the treatment. What do? A medical provider should be responsible for approving healthcare-related treatments, procedures, and choosing what is necessary for a patient and not health insurance companies. In this speech, I'm going to go over how insurance companies are constantly changing the suggested medical orders, how they create red tape for patients to go through to get medical care, and how health insurance companies are causing patients to become discouraged with the healthcare industry. I work in construction, and it's a place where you hear of accidents, either at home or on the job. Some result in a doctor visit, and it's not uncommon to hear a disheartening situation of a health insurance company who you pay a premium to every paycheck has denied coverage or has some discrepancy. With that being said, along with my own battles and ones with close relatives, I believe makes me a credible source for this topic. Have you or a loved one, maybe a friend, had a medical procedure or medication denied? Why are non-medical professionals changing or denying treatment ordered by medical professionals when it affects the patient's quality of care? Not only are treatments and surgeries denied by insurance companies, but also prescriptions are often changed to their preferred brand. This change happens because of the benefit to the insurance company's bottom line. According to American Academy of Family Physicians, in a 2019 article titled Healthcare for All, stated the healthcare system in the United States is uncoordinated, fragmented, and emphasizes intervention rather than prevention and comprehensive health management. Health insurance companies are constantly altering suggested medical recommendations to benefit their bottom line without any real care for any patient's medical needs. The article by Health People 2030, titled Access to Health Services in 2020, wrote, out-of-pocket medical care costs may lead individuals to delay or forego needed care such as doctor visits, dental care, and medications. Since we discussed the problem the health insurance companies cause patients, let's move on to why their denial and approval policies need to change as well. What if only medical professionals were responsible for what was deemed necessary and what health insurance were responsible for covering? Instead of allowing the insurance companies to dictate steps to get a medical procedure approved or just denying it completely, I think a good solution would be to let the medical professionals determine what is necessary and what is not. According to James Baer's quote in 2001, from an article titled Making Sense of Health Plan Denials, said, differences in the perspectives of physicians, health plans, employers, patients, and their families, and a decision-making process that is unclear and unspoken makes a conflict over medical necessity and medical benefit inevitable. The doctors are the ones that see the patients face to face and have already discussed and talked about all medical options that would benefit the patient and the ones that wouldn't. In 2016, Bob Tedeschi stated in an article titled, Are Insurance Policies Saving Patients Money? Said patients are forced to try cheaper treatments before they graduate to more expensive ones, even when healthcare providers are confident that inexpensive treatments will not work. Insurance companies would be required to actually read and abide by the patient's doctor's notes and follow out physician's orders instead of following step-by-step guidelines implemented by insurance companies, prolonging and discouraging patient care. Now that I have discussed why medical professionals should be in charge of insurance coverage, let me move on to my solution that would hold health insurance companies accountable for their actions and prevent them from denying things deemed medically necessary by a provider. Patients would have less stress to deal with, and health insurance companies would be required to go by what the doctor recommended. Patients would be healthier since they actually get the medical treatment they needed instead of being denied and discouraged from pursuing medical treatment. According to Charlie Ray in his study in 2021 titled Access to Care, Cost of Care, and Satisfaction, stated individuals with private insurance were more likely to report poor access to care, higher costs of care, and less satisfaction with care compared with individuals covered by publicly sponsored insurance programs. In conclusion, I think we can all agree that a medical provider should be responsible for approving healthcare related treatments, procedures, and choosing what is medically necessary for a patient and not an insurance company. We have talked about how patients have a problem with the health insurance companies dictating what medical procedures they will approve, and we talked about what if the doctors were the ones that made this decision, and in return, what better health care a patient would be provided if this was the case. If we as patients will continue to voice attention to the corrupt health insurance system and the change that needs to take place, hopefully lawmakers will address their concerns and focus more on a medical opinion.